Good evening, everyone.
Good evening. Welcome to our speaker series. Happy October.
Yeah. Happy October. We are off and running.
Yeah, thank you all for joining us this evening. My name is Sue Weldon. I'm the founder and CEO of Unite for Her, and I am here with my colleague, Erin Pellegrin,
Yes.
and she is our Senior Director of Education and Nutrition, Culinary Nutrition. Many of you may know her because you've actually had sessions with her in our nutrition program, but you definitely see her on our education platform monthly. So welcome. We're really excited about tonight's topic, Erin.
This is a great discussion. We love to do this every year. It's important, it's meaningful. And Sue and I want to set the tone that this is a great opportunity to inquire with our speakers, ask questions. We are fortunate enough to have a fantastic surgical expert with us, as well as one of our Unite for Him members sharing his experience. So please use this time to engage, to ask questions, any concerns. We welcome any dialogue. So feel free to use that chat. We'll have plenty of time for Q&A at the end. So you can certainly raise your hand. But with that, our focus for this evening is all about a shared journey, understanding surgical insights and patient perspectives on male breast cancer. And of course, I want to start us off by thanking our education sponsors because we could not continue to provide these segments and bring these fantastic speakers without their support.
Yeah.
Um,
So tonight, our virtual education events are presented by West, Merck, Lilly, Novartis, and Gilead Sciences. They are all our lead presenting sponsors, as well with support from our gold sponsors, Pfizer, GSK, Daiichi Sankyo, and our supporting sponsors are AbbVie, TerraSera Therapeutics, and Veristem Oncology. So again, we are very grateful, so much so we are doing 40 plus events as well as workshops, 6-week sessions, and we just continue to grow this platform, and it has become incredibly popular with our community. So thank you to all of our partners.
Absolutely. And the show does not stop here tonight for our October segments. So I like to give some reminders, a little teasers of segments that we have coming up. So we are rounding out the month next week with 2 final segments. So we have a virtual hangout on Wednesday, October 22nd at 5 p.m. Eastern. And this is for our metastatic community. Of course, everyone is welcome, but we are moving with strength. So we'll be joined by an expert from Revital Cancer Rehab, talking all about enhancing mobility with metastatic breast cancer. We hear often, and this was a topic that was brought to our attention from one of our members, that the over time, the wear and tear of treatments and changing medications can really impact a person's mobility. And we want to share with you how you can improve that. So we have experts with us to give us some information as well as some show and tell. So join us next Wednesday. And then we have our Ask the Expert. So next Thursday, I will be leading our entire registered dietitian team, 1 p.m. streaming live on Facebook. And we are honing in on our side effect guide. So if you haven't checked this out on our Nutrition Hub, our entire team will be joined and we'll be touching on all side effects from nausea to fatigue. We'll be answering all of those questions, real life solutions to side effects you may experience as a result of treatment. So you're welcome to jump in live with us, share your own questions. It will be recorded and available on our video library, and as well as this evening and all of our past segments you can view at uniteforher.org/UFH Connect. So if you're interested in inquiring about a topic that we may have covered, chances are you'll find it there.
Yeah, very robust library. We've been building it for 5 years now and really feel very proud about it. Yeah. We do want to talk about our other partner, Anna Ono. They have a wonderful promotion. Anna Ono has been doing incredible different types of apparel and breast wear, I would say, for women and men now. So everything from for our women, camisoles and bras and mastectomy products, but she now has a male version, a male vest, which is on their product page now on the website. And you
Mhm.
will automatically get a discount. So we're going to put that into the chat. It's nice to see how all of this is evolving and really coming from our patient forward on what they need as far as just thinking about what is needed after surgery. And we'll hear a little bit more about the surgery outcomes tonight. So that was really wonderful. There's a QR code as well, but I think that link should take them right there, Erin.
Yep, there's the direct link as well as a little promo flyer, but all of that has the information and the code and more information about their mastectomy vest. So if you are someone or you know someone that has a mastectomy surgery coming up, this may be of interest. And certainly we may hear about that from our experts, but we're really happy to bring this to you as a continuing evolution for our male breast cancer patients.
Yeah. The discount code is 20% off and
Mhm,
20% back to you for him. So very good.
mhm.
All right. Shall we get started?
Yes, let's jump in and introduce our panel before we get started this evening. So, let me start by introducing Dr. David Light. Dr. Light is a fellowship-trained, board-certified plastic surgeon with an expertise in microsurgical breast reconstruction. He trained at the world-renowned Cleveland Clinic, University of Pennsylvania, and Fox Chase Cancer Center, and has performed more than 300 primary and complex revision breast reconstructions each year. He currently serves on the American Cancer Society's Long Island Board of Advisors, is a medical advisor for Learn, Look, Locate, volunteers his services with the AIRS Foundation, and serves on the American Society of Plastic Surgeons editorial breast work group subcommittee. He is a busy man, and we are so grateful that he is joining us this evening. And representing Unite for Him, we are so grateful to be joined this evening by Christopher Smith. Christopher has been married to his wife Sylvia for 22 years. With more than 30 years of experience as an electrician, he has dedicated his skills not only to his profession, but also to volunteer construction projects with Jehovah's Witnesses. In February of this year, he was presented with a new challenge. Christopher was diagnosed with triple positive breast cancer. And tonight, we are so grateful that he is taking the time to be part of our discussion and share his experience and his perspective. So please join us in welcoming our guests tonight, Dr. Light and Christopher Smith.
Yeah,
Thank you for
welcome
having
to you
us.
both.
Amazing. So, Dr. Light, why don't we start with you just to
Mhm.
jump in a little bit more, especially for those that are here to learn a little bit more about approaches to surgery in your
Mhm.
male breast cancer patients, as well as any advances or new techniques that you can offer that population. We know you're on top of all of that, so I'll let you take it from here.
Sure, be happy to. So if it's okay, I have a few slides just to go over some anatomical points, which I think are important. Is it possible for me to share my screen? Let me see.
Yes.
It is, yeah.
Okay. Is that coming through?
It is. You
All right,
got it.
excellent. Let's jump into it. So why are women offered reconstruction so more often than men, and why is it that it's very common for men with breast cancer to not be offered a plastic surgery consultation? Part of it is because female breast cancer is just so much more common. Male breast cancers only make up about 1% of all breast cancers, and so it's really not on many people's radars, especially surgical oncologists, and even many plastic surgeons are, not aware of what they could be offering patients as well. And male breast reconstruction techniques are really sort of taking basic plastic surgery techniques and just applying it to the male chest. And I think the consultation for a male patient is important because there are things that can be done at the initial procedure which can improve the aesthetics, and sort of capturing that opportunity to just focus on really basic thoughts and strategies can really help to enhance the overall appearance. There's one of the other reasons why women are offered reconstruction so much often is it's actually a federal law, the Women's Health and Cancer Right Act of 1998, that mandated that all women diagnosed with breast cancer are offered a reconstruction consultation. But I really think that it should be that all patients, whether they're male or female, are offered these opportunities. So for many patients, I think the consultation is important because it sort of will highlight what they don't know about their own chest and their own anatomy, and what benefits can be made at that initial operation. And reconstruction, again, because our mindset is always so focused on the female patient, we're thinking about implants, we're thinking about really restoring volume, making sure that the size is what the patient wants. With the male chest, there really isn't much volume there. It's more about hiding scars, maintaining contour, position of the nipple, because it's certainly different than a female chest. We want to concentrate on restoring normal boundaries of the breasts, and again, preventing missed opportunities. Men who have larger chests, maybe they lost weight and there's extra skin on that chest, that skin can be utilized in the reconstruction to help fill in a hollow that's created after the mastectomy. So it's more about repurposing extra tissue there that's safe to leave behind from an oncologic standpoint, and using that to enhance the contour of the chest. We also want to focus on incision placement. Having a scar that's going directly through the center of the chest is definitely far more noticeable than a scar placed at the bottom of the chest. And then, if possible, utilizing nipple sparing techniques. Now, the reality is most of the breast tissue on a male is focused right under the nipple and the areola, and so many times with male breast cancer patients, the nipple and areola cannot be preserved. But in cases where it can, there's certainly techniques where we can help in that preservation. So what are the reconstructive goals? We want to maintain the chest contour. Can you see my pointer?
Yeah.
So you can imagine if a mastectomy is done, the nipple and areola is removed. Often there's a hollowing at the bottom of the chest. And depending on the surgeon who's performing the mastectomy, sometimes the mastectomy is carried out to the very upper borders of the chest. Sometimes it's more limited where they feel like the breast tissue is just inferiorly on the chest. And so it really depends. The sort of tissue defects afterwards can vary, but we want to try and maintain this contour of the chest as much as possible. We want to pay attention to the position of the nipple on the male chest. On the female chest, the nipple position is ideally centered on the breast and is at the most projecting portion of the breast. Whereas on a male chest, it's not centered, it's a little bit more to the side, and it is certainly positioned towards the bottom of the chest. So on a female reconstruction, the nipple is going to be here. On the male reconstruction, it's going to be lower. And then we want to optimize the position of the scarring, like I mentioned before. If a surgeon was to perform a mastectomy on this patient here, and they used a vertical incision or they used a transverse incision, which is placed higher, then that's certainly going to be more noticeable than if we position the scar right at what's called the inframammary crease. Now, that's an easier thing to do when the male has a little bit more laxity in the breast skin, and we can take the upper chest skin and bring it down to that inframammary folds. But even in thinner patients, we want to, with less skin, we want to try and keep that nipple position down as low as possible. In terms of the nipple and the areola, sometimes it can be preserved. Sometimes we can do what's called a free nipple graft, where the nipple and areola is removed and then placed immediately back on the chest, much like a skin graft. And other times we're doing a nipple reconstruction. Now, for a male, because the nipple is not as prominent as a female nipple, tattoos actually work out very well for male patients. There are tattoo artists that specialize in 3D tattoos, and the male 3D tattoos are, I think, exceptional. It can really help focus the eye. When you look at either a female chest or a male chest, because the nipple and areola is a different texture and a different color, the eye is drawn there. When the nipple and areola is not present, the eye is left to wander, and scars are usually a little bit more noticeable. So for any male who has had a mastectomy, if the scarring bothers them, the position of the scar, sometimes that can be the attention can be diverted by having a 3D tattoo. And that can be done at any time. That can be done years after the mastectomy. So there's no time limit there. So what are some common options for reconstruction of the male chest? Fat grafting is probably one of the most common, and I'll talk about that in just a second. Tissue flaps are less common because it usually means you're moving more tissue, and oftentimes the tissue flaps are too large for the defect that a male mastectomy produces. So you would actually be creating a breast contour that doesn't match the other side, is too prominent. And then there are implants that can be custom designed for men. I have never used one. I think that they're not common, but they're certainly out there and can come up in discussion. So let's talk a little bit about fat grafting. What happens with fat grafting is you liposuction an area first. The fat is then processed it can be processed in a variety of ways. Really, the idea is we're taking the excess fluid out of the fat and trying to get down to concentrated fat grafts. That fat is then transferred into syringes and then injected into the patient in order to treat a hollowing. Now, fat grafting usually does not happen at the time of the mastectomy because you have to inject the fat into a closed area. So if you just had a mastectomy and there's an open area under the skin, you can't inject the fat yet. You have to wait for that to heal, and then you can come back. And fat grafting is an excellent way to add volume to the chest. Now, it doesn't add a tremendous amount of volume. It's difficult to reconstruct an entire female breast just with fat grafting. It takes many, many surgeries. But with a male breast or a male chest, because the tissue loss is not as significant, fat grafting is a great way to add some volume back and treat some of the contour abnormalities or the concavities that can happen after a male mastectomy. So what are the advantages? It adds volume, it corrects these contour deformities. There's stem cells in fat grafting, which can actually, and this has been scientifically proved, can actually improve the quality of skin, especially if the patient has had radiation. And there's really minimal downtime and recovery. So the incisions to liposuction and inject the fat are very small, under a ½ inch. It's an ambulatory procedure, and the patient is usually back to normal activity in just a week or two. The disadvantage is there's a limited amount of fat that you can harvest in some patients that are very thin. There's a limit to the amount of fat that you can inject at one time. So once those tissue planes are filled, any more fat that you add will not heal well, will not reestablish a new blood supply, and you actually start to increase your complication rate of having something called fat necrosis or oil cysts. So you have to be careful with fat grafting. You have to, the surgeon who's injecting the fat has to sort of have a feel for it, understand when the tissue is fully loaded, and not graft any further beyond that, because that's when the complications begin to occur. Fat grafting can be done serially, so it's safer to inject a smaller amount and come back a few months later to do it again in order to meet the patient's volume needs. Let's move on to tissue flaps. So again, these are commonly taken from the back or the side, flaps like latissimus flaps, thoracodorsal artery perforator flaps, intercostal artery perforator flaps. But these procedures are not normally done because, again, the amount of tissue that's moved is almost too much for the male breast. And so for many patients, they're better served with fat grafting. And then, like I mentioned, there are pectoral implants and custom implants that can be designed, but you have the same downsides. to implants that you would have in a female patient with capsular contracture. There'll be future need for replacements, and they're just not commonly used. I just wanted to bring it up just so patients were aware. So I'll stop there and can certainly answer any questions that come up as we go along.
Yeah, feel free to use the chat for any questions, anyone that may be here inquiring with Dr. Light while we have him.
And we have such a small group, Erin. We don't mind if you come off your mic. That's all fine as well. Either way it works. Dr. Light, thank you for doing that quick overview. It's so good to see. I didn't even know that there were implants for men. I didn't realize that. So I'm learning right there along with our community. And we always call it breast cancer for men. It's not chest cancer. Sometimes I hear that being thrown around a little bit, right? But it is breast
Correct.
cancer. Yeah.
It's definitely breast cancer. A lot of times for men, the term chest wall reconstruction or chest reconstruction is utilized, just to differentiate a little bit with the techniques. But it is most certainly breast tissue. There are ductal carcinomas, just like in a female patient, and so it is truly a breast cancer.
Yeah, I liked what you were talking about when you said the nipple placement, because it is so true. I know that once those nipples are on top of that scar, the eye goes to the nipple like tattoo instead of just
Yeah,
looking at the scar. So it could just change your whole feeling of, being whole again.
definitely.
And there's no, and correct me if I'm wrong, it's very hard to spare nipples because really all of the fat tissue is around the nipple for the men.
Yes, many times I would say nipple sparing mastectomies are definitely less common in men just because the breast tissue is, like you said, it's in a very close proximity to the nipple and areola, and so usually you can. More commonly, the patients who are candidates are men who have excess skin. So they may have lost a significant amount of weight, and
Yeah.
so the nipple position is sort of draping now away from the breast tissue, and so there's some space in there to safely save the nipple and areola, but certainly less common than females.
Great. Great.
And
We
for some,
Go ahead, Erin.
I have one quick question, Sue. For someone that may have had mastectomy surgery perhaps years ago,
Mhm.
or it was not something recent, are they eligible to have nipple tattooing at any point
Definitely.
in their future? Maybe that was something that they weren't aware at the time was
Mhm.
available to them, but now they like the idea of having a more natural appearance. Is that available to anyone anytime?
Absolutely. So fat grafting is available to anyone anytime. The nipple tattoo is
Mm.
available to anyone anytime. I think the key thing to having a plastic surgeon involved initially is the scar placement and possibly saving some of the chest wall skin to actually utilize in the reconstruction. So if you can imagine, if there was extra skin, the skin at the bottom of the breast sometimes is actually buried, saved and buried to fill the defect that the mastectomy created, and then the upper chest skin is sewn over that. So you're just sort of um, reorganizing the skin and the underlying fat to sort of fill these contoured deformities, concavities. Beyond that, the scar placement and the media tissue rearrangement, the fat grafting, nipple tattoo, a lot of things can be done down the line. So for anyone who has had a male mastectomy and is sort of unhappy with the scars, scar revisions can be done down the road. Fat grafting can be done down the road. Certainly nipple and areola tattoos can be as well.
Amazing. And will the result always be in a concave uh result after a mastectomy surgery? Like is that, or is it possible that there may be more of a flatter chest result?
It's certainly possible. That's really what you're trying to avoid. You're trying to, with any patient, you're always trying to match the non-affected side.
Mhm.
And so whatever the contour of that chest is your goal. So for some, they may be extremely thin, have a relatively flat contour, just hiding the scars and getting a nice tattoo, maybe, sort of the max that can be achieved. For others, it'll be, trying to replace a little volume on the side that had the mastectomy to match the non-affected side.
Got it.
Great.
Okay, great.
We have a couple questions, some good ones. I actually was thinking this one as well. One is just as far as men getting screened, is it the same? Is it 40 years old like women, that men with a history, or if they're a first degree relative with breast cancer, they could go in and actually get screened and have it covered?
So, I mean, the screening for men is mostly just physical exam. Most men are not undergoing imaging, certainly not mammograms. I think in high risk patients, you can make patients who have a history of, for example, BRCA in the family, that certainly ultrasounds and at least physical exams yearly, possibly ultrasounds would be employed for their monitoring. But beyond that, it's mostly just self-exam. I just brought up BRCA. That's, I think, an extremely important thing that is often overlooked in males in a family. So very common. A woman is diagnosed with breast cancer. She has a genetic panel. She finds out that she has a BRCA mutation. All of the other women in the family will go out and get tested, but it's often not stressed for the men to get tested as well. There are other cancers that come along with some of these genetic mutations, but specifically for the BRCA, the BRCA gene, it's an increased risk for males, and so anyone who gets diagnosed with a genetic mutation, both the male patients and the female patients in that family should be tested.
I know, like for me, Dr. Light, I was 39. So my daughter now at 29 is getting screened every 6 months. Is that the case for my sons? But not really.
No,
No,
I
genetic,
think
no genetic. It's just I was young.
so I don't want to ask a personal question, but were you
No, go ahead.
genetic
No.
positive? You
Yeah.
were
So
not.
no genetic connection.
Yeah, so if there's no genetic connection by the affected people in the family, then usually you would not just broadly genetic test everyone. It's when you have a positive test from someone in the family, it's important that everyone in the family, just not just other women, are tested to make sure that male breast cancers, because many male breast cancers are genetically related as well.
Okay. Not so much with our young women though. That's why they're getting tested early. Like she's 10 years to get screened younger than I was as far as the diagnosis date. So
Yeah, her surveillance. So if
yeah,
you have a relative mother who was diagnosed at 39, many will start the screening, the surveillance for younger family members, especially first degree relatives, 10 years prior to the date of the family member who was diagnosed. So 29 makes sense.
yeah. But that is just for the women, not for my sons.
Correct.
Okay,
Be-
that's what I was just
Yeah.
wanted to make sure I understood that. And then there's so much, we understand the health disparities that we see with our Black women and breast cancer. We're actually doing a big campaign, Care for Her, this October about Black breast cancer and,
Mhm.
just the mortality rate. Is that the same for men as well?
I actually don't know if that's the same for men. I don't know if anyone has looked at it. Because the incidence is so much lower in men. I think it's a bit more of a challenge to study male breast cancer. You don't get it's very easy with women, some of the statistics show that 1 in 8 women will develop breast cancer over the course of their lifetime. So gathering subjects for studies with female breast cancer is so much easier, and you can collect data and get information so much more readily than in the male community.
Okay. And then with breast cancer in men, is the common age group very similar to women? That age is 62. Is it a very similar type of average age of breast cancer in men, or the same answer that you just gave on the
Yeah, I mean,
numbers are so low that it's hard to have an average?
I think it's certainly variable. I think that the age for even women has dropped a little bit over time as the information on different genetic mutations have come out. 10 years ago, 15 years ago, all we had was BRCA. Now we have information on, RAD mutations, check mutations. And so there's definitely a younger cohort of patients that are being diagnosed and treated now. So, 20 or 30 years ago, it was the classic like postmenopausal, woman in her, late 50s, 60s. That was your classic breast cancer patient. But I think that that demographic that we're seeing now is certainly changing. And I would imagine it's the same for men as well.
Right. Okay, I think we got them all, Erin, there.
We do, and we have Angelia with her hand raised, and we'll allow you to take the floor, and then we'll jump over to Christopher.
Okay, thank you. Just a quick question, Dr. Light. This has been awesome. Thank you so very much for sharing with us on today. Are there environmental reasons or anything specifically that causes men to have breast cancer other than they have breast?
No, I think that it's no environmental reasons that I'm aware of. And people have certainly looked at this, especially in specific general locations. I'm on Long Island, and there are certainly areas on Long Island in New York that have higher rates of cancer. And there's, been concern for, previous industrial companies have been in the area, and people have looked at, soil samples and water and stuff like that. There has not, to my knowledge, there's never been a direct link to any of these areas and a specific cancer like breast cancer, or even more specifically male breast cancer. I think there are genetic components, and then there's just, throw it into the category of bad luck. There's the cell process just goes awry, and we develop cancer for a variety of different reasons.
Thank you.
No problem.
I will call one more question out in the chat before, because I do think that this is a great question. So if genetic tests are done on men and they are positive, could they have a preventative mastectomy? Could they have their breast removed? Have you had a patient that has had that? That's a
That's
great
actually
question.
it's actually a great question. And yes, you can have a preventative mastectomy. And yes, I have done a male reconstruction on a fellow physician whose was BRCA positive, and he had a prophylactic mastectomy. He had I believe two males. I know it was his uncle, and I think one other male in the family that actually was diagnosed and may have actually passed from breast cancer. And so to him, it was very important to sort of not go down that same path. And he educated himself and sought treatment and had a prophylactic mastectomy. And I was fortunate enough to help him with his reconstruction.
Great question.
Yeah.
Good. All right, thank you, Dr. Light. And I think at this time, we're going to bring on Christopher.
Yes.
Yeah. So Christopher, we're going to let you take the floor. And I feel like we thank you for being here. First of all, Christopher has helped us with a couple of our events as well, because it is so valuable to just get that voice out there, Christopher, and to be able to talk openly about it. So we appreciate you here tonight. And how about if you start by sharing a little bit of your story with us?
Well, thank you very much. So my background is been an electrician, as I mentioned, 30 plus years. I've been married for 22 years. 2024 found me being a gym rat. I was pretty active in the gym, 3 times a week. So I was in pretty decent shape. Once again, it was mentioned that, a lot of times guys don't detect that they have breast cancer. The way I found mine out was actually by accident. I was pulling my toolbox out of my truck. The toolbox fell and hit me in my chest. Put it back in, and that hurt. Later on that evening, I felt a lump there where it hit me. And my thought was, okay, it was a hematoma, probably, swollen a little bit. We'll let it ride. 30 days later, that lump was still there. I mentioned it to my wife. She says, maybe you need to go to the doctor. Fortunately, I had an appointment coming up in 3 weeks. So I said, I'd talk to him about it there. Explained to him what happened. He said, yeah, it's probably a hematoma. It'll take, normally takes 2 to 3 months to go away. Just in case, here, I'll give you a script for mammogram and also for ultrasound. All right, cool, not a problem. That was perfect for me. My wife and I had been accepted. We were helping out with a volunteer project in Long Island. So it's good to see you, Dr. David. I was in your neck of the woods. We were up there 6 weeks doing a volunteer building project. Came home, my first day back at work. I'm working in an office building, went to the men's bathroom. I'm washing my hands, and I looked over onto the mirror, and there was a printout. And it was a printout about men's breast cancer. And it talked about some of the symptoms that you can see a lump, that you could see a recessed nipple, discharge, bleeding. And I looked at it and I said, wait a minute, I've got 2 of those symptoms. I better go get this checked out. So right away, made an appointment to get my mammogram and ultrasound down. Okay, women, I understand now. I never thought I would experience that in my life, but yes, a mammogram is a pain in the butt. But I went through it, and they found something there that they said did not look good. They wanted me to come back a couple more days later to do a biopsy. 3 days later, February 14th, it was a Friday, I got the call and they said, it's cancer. Boy, when you hear those words, it hits you. Your first thought is, well, that's it. I'm done. I got cancer. Then afterwards, I thought I'd be smart and go online and look up the statistics for males, the 5-year prognosis for men with breast cancer. Don't do that. Don't do that. That ain't going to do nothing but depress you. Those numbers are down. And what I come to find out later on is the reason why it's so low is because, once again, men normally don't check for breast cancer. So when they finally find that they have breast cancer, it has progressed so far that it lowers their chances of living for longer. And also, they mentioned, too, that the results for 5 years are 5 years old. So there have been updates and changes that have been found and things that are working better, so forth, so on. So those numbers should come up as time progresses. But once again, the big thing is finding things early. My wife and I, when we discussed this, at first she didn't want to accept the diagnosis. No, we should get a second opinion. And for me, I'm like, I want to move forward. Let's start going. Faith is a large part of my life. I'm one of Jehovah's Witnesses. So for me, one of the first things I did was pray about it, not for a miracle, but just to keep me upbeat doing this. How many times do you see people with a woe is me attitude that can be completely healthy and can't get out of the bed? So my thing was, help me keep my attitude up. Help me keep an upbeat personality. And it's worked out. Even if you're someone who doesn't believe in God, the idea of your attitude plays a large part in the success that you have in dealing with cancer. So once I got my head wrapped around it, I actually didn't take me long. I called back to the imaging and asked them if they had any recommendations. They've seen a lot of this. What kind of surgeon would they recommend? Well, they sent me to my surgeon, Dr. Renee Quarterman. Man, Renee Quarterman is awesome. She also works with a team. They're medical oncology, hematology consultants, which was kind of nice because it was one-stop shopping. In the same group, I found my surgeon, I found my oncologist, they had nutritionists available. So anything I needed was right there. Now, some people would rather go and find, talk here and find. I didn't want to waste time. I said, hey, everything's here together. I looked right into her right away as soon as I found out who she was. Highly recommended online. And I went, okay, I'm going to run with this. I got to admit, it made for an interesting team. Dr. Quarterman is so upbeat. She's hopeful. She's a source of great encouragement, a source of good information. She had me get testing done, and I found out that I am BRCA2 positive. So that made me more susceptible to actually having cancer. She's the one that actually introduced me to Unite for Her. So she's the one that actually gave me the information to get in touch, and man, that was just a big help. She helped me out with getting samples and coupons. I mean, anytime you talk to her, it's what else information can I give you? How else can I help? And that was just huge to hear when you're dealing with that. Dr. Shah, my oncologist, completely different. Down to earth, realistic. I mean, I remember talking to him, boy, and it was like, hey, with chemotherapy, you're gonna have diarrhea and constipation in the same day. Your taste is gonna change. I mean, he knocked you back down. So it was a nice balance between one that kept you up here and one that kept you here. So you kind of stayed in the middle the whole time. He made me understand that this was not going to be a walk in the park. There was some work with it. Unite for her has been such a huge help. Once again, that's your mindset and hearing that you have cancer, and it's something you got to deal with. And when that box showed up at my house, that little ray of sunshine saying, hey, we know what you're going through. We got your back. And all of the recommendations they gave for things to help out while we were going through that. It was awesome. They even invited us to walk in a fashion show, my wife and I. Now, 50-year-old electrician, I'm walking in a fashion show. And it turns out I had a blast. We had a great time there. The audience pumped you up the whole time. You really felt like everybody had your back. And once again, attitude being the big thing in dealing with cancer, that was huge. So I really enjoyed that fashion show. Once again, the diagnosis came back, stage 1A, triple positive cancer. Triple positive, right where I went, oh, I'm dead. That don't sound good. Well, they said, no, that's actually really good to prognosis because it's not a super aggressive cancer. It was caught pretty early. It was something that they said they can not just put in remission, but cure, get rid of it completely. They told me basically it was going to be 6 rounds of chemo and then surgery. To me, I'm saying, hey, we got a game plan. Let's go. One thing my wife and I discussed, though, was wanting to be public about it. We wanted to make sure that everyone knew when we were open and honest about what my diagnosis was. A lot of times you hear breast cancer right away, it's thought of a woman. So for a man to come out and say breast cancer, you get the side eyes. I remember I called a buddy of mine and I told him, I said, hey, I just want you to hear from me first that I have breast cancer. And I got silence on the line. I said, hey, bud, you okay? He said, I'm waiting for the punchline. What's going on? There ain't no punchline, bud. I have breast cancer. And he's like, but you're a guy. I said, yeah, same thing I told the doctor. It didn't make a difference. So now he said he's starting to talk to all the guys about it as well, about getting checked for it. His wife is on him about constantly getting checked, check and make sure. So it's been a big help to let people know what's going on. Also, people want to help. People want to help out. And they can't help you if they don't know what's going on. I know in my case, when the weeks that I had chemotherapy, friends were making meals for us and preparing not just for me, but also for my wife. So she didn't have to worry about that. They were helping out with us having food. My wife wanted to sit there with me all day long. She did not want me to leave her. She didn't want to leave my side for anything. But I also realized, though, she needed to break from this too. As a caretaker, that's tough to watch someone that you care about that's going through this kind of stuff, especially because with me with chemo, it really changed a lot. I was tired. I'm not that type. Normally I'm go, go, go. Well, all of a sudden now I'm laying out on the couch just it was tough for her. So we made sure that she could go out and do things and friends would come sit with me. That way she didn't have to be worried about what was happening to me while she wasn't there. There was always someone there keeping an eye on me to make sure that I was okay. Also, we talked to work about it because realizing with cancer, it was going to affect my work. And man, that's probably one of the best decisions I ever made. I work for a company called Advantech. My boss is a woman, Tracy Daddio, and she just had my back from the very beginning on this. She made sure my work schedule would be changed, no problem, at the last minute for doctor's appointments, for chemo infusions, for anything that I needed. My schedule changed. When I came into work, first thing is, hey, how's it going? And my answer was, hey, well, on this job, no. How are you? She wanted to make sure that I was okay. And all I could do was sit. She was going to have a job for me where I could sit and point. If I was up for working, then I could work. I mean, she had my back. She was the first one sending me messages on the days of my infusions. All right, you got this. Well, what are you doing up this early? Didn't matter. She had my back. Sent gifts, all kind of Superman gifts for me, saying that she had my back, and even organized through work a fundraiser to help us out with the time we're missing for work. So it was really good that we let people know because we really had a lot of support. Chemotherapy, that was an experience. Some things about it stayed the same every time. But the change of taste thing, oh, that was horrible. The reason why just so you know, why people with cancer don't eat, because everything's nasty. Everything's nasty. About 2 or 3 days after, everything tastes that. Peanut butter jelly, my favorite. And the peanut butter tasted like cardboard. The jelly tasted like clay. So you just learn, okay, stay away from the foods that are your favorite so you don't get a bad taste for it. Another problem I had was a constant nasty taste in your mouth. Normally if you taste something nasty, you take a drink and clear it out, spit something. Didn't matter. That stayed with you. having to deal with things like neuropathy, getting numbness in hands and feet. Something's changed. 1 week, for 2 weeks that I had chemotherapy, I was dog tired. The third week, I couldn't sleep. I was up 4 o'clock in the morning, pacing around the house because I had to do something because I was not tired. But so it was weird. You never knew what was coming next each time. But as you're dealing with it, you kind of learn what kind of things changes you need to make what works for you. For me, apple juice still tasted good. I don't know why that taste didn't change, but hey, I could drink apple juice all day long and it was good. For me, I know I had taken more protein since I wasn't eating more, so I was trying to drink like muscle milk, things that had protein added to it. I know it's not the healthy thing, but hey, it helped me make it through there, not to fight with keeping the weight up. Dry mouth lozenges was something too to help get that taste out of your mouth. You're sitting there, by popping that in your mouth would help clear that out. Peppermint candy, fresh fruit popsicles. These were different things. Cold stuff would actually help get that nasty taste out of your mouth for a while. And I learned that, hey, even though I was normally on the go, when I had my infusions, I had to rest. Take that week, shut down, rest, so that I could be back up and moving the weeks in between. So we went through 6 rounds of chemo every 3 weeks. After we got past that, during that whole time too, my oncologist did not want me eating steak or drinking wine. I almost slugged them. What? So yeah, that was tough. So during that whole time, we did not drink wine or eat steak. But I'm gonna tell you what, after we got past our final round of chemo and 3 weeks past that, I went to the office and said, "Can I have my steak and wine now?" And he says, "You deserve it. Go out and have dinner." Family took me out for a steak and wine celebration. It was a blast, just all of us being together after having gone through all that. The surgery. So we had, in my case, we decided to go ahead and do, the question was, do we just do a lumpectomy where they're just removing, or are we doing a full mastectomy? In my case, because of where the tumor was, it was right in the ductal canal behind the nipple. And Dr. Light, you understand that better than I do. But because of the location, I was going to have to lose the nipple either way. So to me, it was like, well, don't fool around with lumpectomy, and let's just go ahead and take the whole thing because it's less for it to come back. And then my thought was, well, then ain't I going to be lopsided? And then I'm leaving breast tissue there where cancer could possibly come back in the future. So I made a decision personally, especially with me being BRCA2 positive, best to go ahead and just do a full mastectomy. We had discussed that with reconstruction. And it was something that was placed out there, asked if I wanted to bring in a plastic surgery or such. I thought about it. My wife and I discussed it. And in reality, we decided, you know what? I decided that it was not something that I wanted to do at this point, just because of the fact, personally, I'm not one with my shirt off all the time. It's not like I'm at the beach all the time. No one's going to see it. It's just me. And besides that, when you hear some of the pros and cons of things, I was like, well, the pros is more aesthetics. Once again, it's only me and my wife is going to see it. So she and I discussed it and it was like, forget it. But there was given the option, it was told to me that you can still go back and if you change your mind, you can still go back and do it up to 2 years after. So it's still an option on the table if I decide I want to change my mind, but I think I'm pretty content. She did a nice job. You can't tell looking at me that I've had a dual mastectomy. I still look the same. My surgery, there were complications with it. There was a hematoma, so it made my blood count drop low. As one of Jehovah's Witnesses, the first thing they want to do, well, they wanted to give me blood transfusion, but as a Jehovah's Witness, I couldn't accept that. So we had to go through a whole bunch of back and forth. When they went to take me back down to take care of the hematoma, that was a battle, because you realize they want to save your life. And for me to say, no, I'm not accepting blood transfusion, they kind of felt like I was tying their hands behind their back. So they really tried to convince us that I needed a blood transfusion, whether it was nurses, doctors, anesthesiologists. So it was kind of a battle there. But I got it, man, when we got down into the surgery room and they started talking to Dr. Quarterman, she says, I got this. Yeah, well, you need to understand, I already know. He and I have already discussed this. This is my patient. Yeah, but, what we think you already discussed this. This was the game plan. Is this what we're going to do? I've got this. Boy, I looked at her and said, put me to sleep. Let's go. She's got this taken care of. It was, after that was 3 weeks recovery because my blood count had dropped so low, I had to stay home. They didn't want me to risk doing anything where I would risk cutting myself, bruising myself. So I had to stay home and kind of stay protected here in the house. One of the things that has now come after the fact is I have a thing called lymphedema. Because there are lymph nodes, I had 2 of them that were removed. They wanted to check to make sure that the cancer had not passed to anywhere else. Because of that, they had to remove 2 lymph nodes to check them. In my case, they came back as clear. But because the 2 lymph nodes were removed, now I have an issue with fluid will gather in the area. So I'm going through now. I'm getting set up with physical therapy. They're teaching me massages and stuff that I need to do fluid movement. They also have me get me compression garments that help out with moving the fluid around the body. So it's a minor inconvenience, but not anything that I can't live with. So lessons learned out of all this. First of all, look at the good things. You know, don't focus on the bad. You got cancer. That's bad. But there's so much good behind this. You have so many people that are behind you, people that have your back. If you're going to have cancer, breast cancer, my goodness, is probably the most researched cancer that's out there. So don't look at things. Oh my goodness, don't get down. You've got people that have your back. You've got organizations like Unite for Her that have your back, that will help you to find the help that you need for different things. Number 2, let people help. People want to help. Make sure that you are willing, and you know, it can be, I know it can be an uncomfortable subject. Oh, I'm a man, I have breast cancer. So be it. Let people help. The final thing that I've learned, and I'm still learning, is this is a marathon, not a sprint. You know, at first I was like, all right, 6 rounds of chemo surgery, I'm done. No. Now you still have to do another 14 rounds of infusions, and now you have lymphedema, so now you have to learn how to do things different. And hell, we need you to take these pills, and it's a marathon. But once again, what attitude are you going to have in dealing with that? Are you going to go ahead and say, I can take this on, let's go? Or is it going to be, I can't do this? That's going to make all the difference in how you make out through this. So once again, hang in there. And if you have family and friends that are dealing with breast cancer, keep supporting them. Keep them upbeat. That will make a big difference in how they make out with this. I'm sorry, I just saw a question pop up in there about my shirt. This was actually a gift from my friends. My friends, dark humor is big with my friends. When we talked about this, that I was going to have a dual mastectomy, one of my friends had this shirt actually made up for me. She made this, and she also has one where it stitches. So either one, I can change shirts. I have another friend that said, because you know, she was concerned I might miss my nipples once they were going, she had me a shirt made up of a muscle man shirt with, you know, abs and the chest, and you can see the nipples. So she said if I miss them, I could go ahead and wear them. You know, it's just dark humor. This is just my friends keeping me upbeat.
That's
I
good,
love
Chris.
that.
Yeah, thank you for just sharing your whole path there. And one thing that stands out to me is your relationships, Christopher, whether it's with your friends, your family, your, you know, partners, your medical team. Your medical team, you really, that's so key to believe in your doctor and to not stop until you find the right one. And you totally found the team that you felt so confident in, and I can see it in the way that you tell that story. And I think it just allows you to really be able to release and let the experts get in there and do what they need to do, and keeping that, you know, positive frame of mind, which is very hard to do, very hard to do. Yeah.
Well, we had good support, you know, to help keep positive. You know, it's not something you do on your own. Uh, once again, like you said, my medical team was awesome. They had my back. Anytime I had questions, I could ask. You know, and it wasn't just when I was in the office. Later on, something would come up, I could make a phone call in, and if they couldn't answer right then, they would get back to me later on the day with an answer. So I'm an electrician. I can tell you how to fix the wire in your house. I can't tell you how to fix cancer. I leave that to the professionals, and they did a great job. I was very happy with everything they did for me.
Yeah, I think kudos to your primary care doctor. You know, you had an injury to that area that could have explained the lump, but they didn't stop there. They sent you to, you know, for imaging to work it up you know, rule out something that, you know, is not common, but something that is, you know, certainly needs to be addressed and worked up. I think that your story is for men is a common story that you hear. There was some event, whether it was an injury to the area, or you give a loved one a hug and they feel something, or you're, you know, in the shower washing and, you know, you just happen to notice, you know, something that felt a little bit different. There's always, you know, a similar thread to that, and how, you know, many men are diagnosed. It's not the I went and had a mammogram, or I was in my primary care doctor and they felt a lump. You know, just because we're only getting checkups, once a year, and it's not something that's all that often. And so it's usually fortuitous happenstance that brings it up. But the important thing is to, do what you did and actually seek care, get it evaluated, get it worked up so that you're not just, letting it slide by.
And I don't think it's something, in all the years of going to the doctor, I don't think I've ever been checked for breast cancer. It's
Yeah.
funny because
And
that's part of a woman's test. They always tell them constantly check, but no one ever teaches guys that, hey, you need to be checking too.
yeah,
That's one of the big things we want to do is make sure it's out there so people are aware.
yeah, absolutely. I mean, I think it's not a common thing that's part of the physical exam. I think some doctors, when they're listening to your heart and lungs, they're, feeling around in the chest as they're moving it. And so, I've actually asked my primary care when they're out auscultating, I'm like, you checking my chest? And they're like, yeah, I'm doing more than one thing at the same time. So he sort of giggled that I was questioning him. But I think it's not part and not in the mindset of many physicians. They're listening for heart murmurs, and they're, want to know what your cholesterol is, and checking all of the very common health issues, as they should. The male chest is often overlooked, and really needs, I think it's on the onus of us as men to, just do simple checks just as women do. Especially if there's any sort of family history, it just has to be higher on your radar.
And I'm
We never,
glad you
I'm sorry.
I was going to say, Dr. Light, I'm glad you mentioned that. Christopher, if I may ask, under knowing that you have the BRCA mutation, if you talked to anyone in your family who may be impacted and how that experience or those conversations went, because I'm sure that can, it's not as welcoming to all of the men in our lives. So I'm curious how that went for you, if at all.
Well, I'm chuckling because one of my brothers is connected right now. I see his wife on here. So I know he's in the background. I've had the conversation with all three of my siblings. The minute that I found out I was BRCA2 positive, because hey guys, you need to go out and get tested. My sister got tested and she came back negative. So my two brothers, I'm still going, okay, you guys, getting tested or what? Uh my brother is connected. He told me, well, yeah, he's going to get tested, but he wants to make sure to get the insurance for cancer first before he goes and gets the testing done. So I can't fault him. He is going, but I have talked to both of them about getting testing done, and hopefully, if all goes according to plan, they're both getting tested at the beginning of next year.
Good.
Good. Yeah.
Yeah, for men with the BRCA gene, it's also important because you're at an increased risk for prostate cancer as well.
Yeah.
Yeah, they've done checked me for everything. They done ran prostate, the colon, the skin cancer. They ran through the whole shebang of tests.
Yeah, we've heard that, Dr. Light, as well. With our women, BRCA has affected, ovarian cancer. And I think for the men, it's the prostate. And just again, another learning for our men on why to get that genetic testing, why Christopher's brother is definitely going to get tested next year. And we're happier that you're that voice, Christopher, because you just normalize what this needs to look like in the future. Yeah.
Thank you very much. I appreciate that.
Yeah. Yeah. Well, do we have anything else for our audience? Let's see. Will insurance pay for genetic testing? Dr. Light, oh boy. I think it's like if you have a risk in your family. So I think if Christopher, his first brother, his relative, they do pay for that. Is that correct?
Yeah, um, many insurances will. The good news with genetic testing, 10, 15 years ago, it was quite expensive. Now it's actually pretty affordable. You can have a pretty extensive panel for just a couple of $100. And so even in instances where the insurance won't cover, and there are also many of these companies will have programs where they'll offer it at reduced rates, especially if there's a family history. So certainly worth looking into. Ideally, you can certainly do it on your own, and many of the companies have genetic counselors that are available to sort of explain the results, because the results from genetic testing is usually a packet. It can be, 15, 20, 25 pages long. There's a lot of abbreviations. And so sort of making heads of tails of it can be difficult. The ideal situation is a physician sends you for the testing, and then there's a genetic counselor that's available, an individual that has training in this and can walk you through the results so you have a better understanding. There's variable of uncertain significance, VUSs, that come back where you really don't know what the impact is yet, and you're put in a database. So as more information comes in, you may get a letter down the line saying that your VUS is nothing to worry about. We have enough data now to show it's not a problem, or your VUS is concerning. Go back and see your physician. You need more counseling. So genetic testing is it's great, but there's a lot of information that comes at you, and try and set yourself up for a situation where there's someone there to educate you on the results.
Agree, 100%. Having that counselor is key. You can't just do that 23andMe or go over the right online and get
Yeah, I mean,
your
you
test.
you certainly can, but it's much nicer to be walked through the results for sure.
For sure, for sure. Well, that was wonderful, Erin. Thank you, Dr. Light. Thank you, Christopher. It's so
pleasure.
valuable. We appreciate both of you so much for bringing this topic right to light. And thank you to Christopher's family for joining us tonight. I do love that. You got a good village around you, Christopher, and I am appreciating all that you give out. You give out a lot of light, Christopher. So
Thank you
thank
very
you.
much.
Yeah.
Thank
All
you.
right.
Amazing. All right, so much to cover. I'm so glad we had this discussion. Hopefully that provided some clarity for those that may be going through surgery or deciding on surgery, but just always knowing that there are others that can share their experiences and you're not alone. So I'm really happy we had this discussion.
Yeah, could not agree more. All right, a
Absolutely.
couple of reminders of what we have coming up at the end of October, which we are at that halfway mark. It's hard to believe. Virtual hangout on Wednesday, the 22nd at 5 o'clock. Move with Strength, Enhancing Mobility with Metastatic Breast Cancer. Revital Cancer Rehab is going to be our guest, and they are no stranger to Unite for Her. We've had them on quite a few times and just an expert in that field. And then we have the Ask the Experts on Thursday, the 23rd. Erin, you're solo on both of these. I'm away next week. So
I know, but I'm happy to be joined for this one with my dietitian team. So it's always good to hang out together, and I get to buzz them about side effect management. So we'll be talking all about our side effect guide and managing any number from head to toe of treatment side effects. So if you have something that you want to inquire about, you can submit those questions as well, and we'll get through as many as we can.
yeah, perfect. And then one last special thank you to our sponsors for this evening's event. Unite for Her Connect is brought to you by West, Merck, Light, Novartis, and Gilead Sciences, with support with our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and our supporting sponsors, AbbVie, TerraSera Therapeutics, and Veristem Oncology. We appreciate your support. It is because of them we can bring such incredible panelists on and very up-to-date topics. With that being said as well, if there's anybody in the audience that there is a topic that you feel like you would love for us to cover, know you can email us anytime. I think the easiest email to put out there is probably info. So info@uniteforher.org. And we do look at those. We do survey our members as well. So we're always looking for new topics that just help our community be up to date with the latest breakthroughs and maybe what is front of mind for them going through this cancer journey all the way through. Yeah.
Wonderful.
All
All
right.
right.
Perfect.
On to it. Yeah, thank you so much
Thank
for
you.
joining us this evening. Thanks for all your questions, Dr. Light, Christopher. Thank you so much for making this a truly fantastic segment.
Thank you for having me.
Yeah. Thank you.
Wonderful.
Hey,
And
good night.
hopefully we'll see some of you at our 5K this weekend. So
Yes, I know. I'm sorry. I was telling people downstairs that we're getting people, we have people coming in picking up their bibs. 3,000.
Wow.
1,000. The
amazing.
Congratulations.
streets of Westchester closed down. So you're not doing anything. Come on over. Yeah.
Come on down. Yep. Wonderful. Well, have a great night, everyone. And hopefully we'll see you next week. I will see you during our education segment. So take care, everyone.
Thank
Good
you.
night,
Good night.
everybody.